These are not hypothetical losses. The Medicaid adjustments from last year were actually not scheduled to actually be implemented for a while, but these institutions look at the Medicaid percentage of their population and the Medicaid changes, and they realize they just can't make it work. And all of these closures in Virginia, the OBGYN ward in Farmville, so you have to travel a lot farther to have kids, primary health clinics, all of them are in rural Virginia. And overall, the Virginia Hospital Association indicates that they'll lose $34 billion over 10 years as a result of the OBBA. Now that I know that CMS should focus on that, or Dr. Oz should focus on that, I'll direct my questions that way. But I think it's important for everybody in this room to know if these closures in rural Virginia are happening even before the Medicaid changes get implemented, we're going to see an awful lot more of them.
Can I reply?
Please.
First of all, Senator, I think it's an absolute tragedy to lose those hospitals. I know what that does to rural areas from touring the country, that you're not just denying people access to health care, but it is an economic driver for those communities. It's the largest employer in many cases, the highest pay, and businesses will never move there once that facility closed. So we're doing everything in our power. This is not a problem that was created by the Trump administration, the one big, beautiful bill, which hasn't even gone into place yet.
Yeah, but can I just say,
lost 120 of those hospitals over the past 10 years.
Yeah, not in Virginia. Interestingly enough, not in Virginia. And all three of these cited the reconciliation bill as the reason for the closures. I'm glad you walked through the challenges, because you're right, it's not just the loss of patient care. It's also the loss of jobs, healthcare jobs. And as you point out, once the hospital closes, it's really difficult for businesses to move into these communities because they realize we can't move because there's no health care available. So I like the fact that you connect all the dots in this, and I'm just urging my colleagues, as these Medicaid cuts actually get implemented, I think these closures are going to become even more dramatic and need this committee's attention. I yield back, Mr. Chair.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.